The most dangerous part of a medical emergency is often the first 3 minutes, and most seniors still spend those minutes doing the exact wrong things. If you want to stay healthy and independent as you age, hit that subscribe button right now. We share simple, science-backed health tips like this every single day. Here's the thing. Doctors, nurses, and paramedics see the same pattern again and again. A symptom starts. The person waits. They call family first. They look for their glasses. They try to walk it off. And those small delays turn into big damage. What I'm going to show you today is a simple 3-minute emergency technique that can help you stay safer before help gets there. Now, before we continue, tell me your age and where you're watching from in the comments. This helps us understand who we're helping. Here's what most people get wrong. They think the emergency starts when the ambulance arrives. It doesn't. It starts the second your body sends the warning. That first minute matters. The second minute matters. Even the third minute matters. Why? Because your brain, heart, and lungs hate delays. A 2024 study from the University of Michigan and Brown University found that the median time from stroke symptoms to hospital arrival was 176 minutes. That is almost 3 hours. In the same report, emergency teams were about 20% less likely to alert the hospital ahead of time for some patients, which shows how fast things can break down when the chain of help is slow. And it gets worse. A 2023 study from the University of Chicago Medicine found that nearly 75% of acute stroke patients waited more than 2 hours for transfer to a stroke center. Their median delay was 174 minutes. The researchers also found that when EMS called ahead, transfer times dropped by about 20 minutes. 20 minutes may not sound huge, but in an emergency, 20 minutes is not a coffee break. It can be the difference between walking and not walking. Look, many people still think severe emergencies are always dramatic. They think a stroke means collapse. They think a heart attack means movie-style chest clutching. But your body does not always use loud signals. Sometimes it whispers first. A 2024 study from Sahlgrenska University Hospital found that the common fast stroke check caught 94% or more of moderate and severe strokes, but only 59% of all strokes overall. Why does that matter? Because mild or unusual symptoms can fool you. You may think it's nothing, but your body may be telling you something serious. So no, the smartest move is not to wait for symptoms to become obvious. It's not to wait for your daughter to call back. It's not to lie down and see how you feel in 10 minutes. The 3-minute technique is about doing the right small things fast, while your brain is still clear enough to do them. Number 5, call 911 first, not family. Most people think calling a spouse, child, or neighbor is faster, but actually the first call should be emergency services. Always. Why? Because family can comfort you, paramedics can treat you. Think of it like this. Your family is support. EMS is action. Your daughter can drive fast, but she cannot start oxygen. She cannot do a heart tracing. She cannot call the hospital from the road and say, "Get the stroke team ready." A 2024 study from McMaster University, the University of Sherbrooke, and the University of Ottawa found that sending a heart tracing, called an ECG, from the field cut death rates by 47% in severe heart attack patients. Mortality dropped from 13.7% to 8.9%. It also cut time to treatment by about 33 minutes. That is what happens when professionals are involved early. So what do? The second you feel sudden chest pressure, face drooping, arm weakness, slurred speech, sudden severe shortness of breath, fainting, or a crushing sense that something is very wrong, call 911. If you are alone, put the phone on speaker. If you can speak, say your address first, then say the symptom, then say when it started. Say it like this. My address is 25 Oak Street. I am 72. I have sudden chest pressure and sweating. It started 10 minutes ago. Simple, clear, direct. Do not tell a long story. Do not start with your whole medical history. Start with the emergency. Address, age, main symptom, start time. That gives the dispatcher the keys they need. And please do not say, "I don't want to bother anyone." Let me be clear. Chest pain is not bothering them. Sudden weakness is not bothering them. Trouble breathing is not bothering them. That is exactly why they are there. What if you are not sure? It is serious. Call anyway. It is better to be checked and be okay than to wait and lose time you cannot get back. Your body does not hand out refunds for wasted minutes. Quick question. Have you ever waited too long before getting medical help? Comment yes or no below. Number 4. Say the time out loud. Most people think symptoms alone are enough, but actually time is one of the most important facts in the whole emergency. Doctors need to know when it started, not when you decided to call, not when it got scary, when it truly began. Why? Because some treatments only work inside a certain window. For stroke, one of those treatments is a clot-busting drug. That means medicine that can dissolve a blood clot. There is also a treatment called thrombectomy. That means doctors physically remove the clot. Both depend heavily on time. This is why you should say the time out loud the moment you notice something serious. Look at a clock, look at your phone, then say, "It started at 2:14. If someone is with you, tell them to repeat it too. Why does saying it out loud help? Because stress scrambles memory. Fear makes your brain slippery. 5 minutes later, you may not remember if it started before or after breakfast, but if you say it out loud or write it down, the time becomes real. A 2023 study from the University of Chicago Medicine found that emergency systems moved faster when EMS had the right information early. Again, the time savings were about 20 minutes. That may not sound dramatic, but if your brain is being starved of blood, 20 minutes is huge. Here's the simple move. After you call, speak the start time, then type it in a note on your phone if you can. If you have a pen nearby, write it on paper in big letters. If a family member is there, tell them, "Remember this time." And do not change the time later just because symptoms got worse. The right time is when the first important symptom began, not the strongest one, the first one. This is especially important with stroke symptoms that come and go. A numb hand, blurry vision, a sudden balance problem, trouble speaking. These may fade for a few minutes, but the clock does not reset just because the symptom briefly eases. You may be thinking, do I really need to do this? Yes, because in emergencies, good treatment is not just about what you feel. It is also about what the team knows. But wait until you see number 3, because this is the step almost nobody thinks about, and it can save precious minutes. Number 3, sit down, unlock the door, and clear the path. Most people think they should keep moving while they wait. They pace, they gather random things, they walk to the bedroom, they head to the bathroom. But actually, once the call is made, your job is to stop the chaos. Think of your body like a car with the warning light flashing. You do not take it for a joyride. You pull over. Sit down in the safest spot near the front door if possible. If you are short of breath, sit upright. Do not lie flat unless a dispatcher tells you to. If you feel faint, sit with support behind you. If you think you may pass out, get low and safe. Then unlock the front door. If you have 2 locks, unlock both. Turn on the porch light if it is dark. If you live in an apartment, buzz the main door open if you can. If you use a gate code, keep it on the phone screen or say it to the dispatcher, then clear the path. Move the walker if it blocks the doorway. Move the small rug. Move the pet bowl. Put the dog in another room if you safely can. Why does this matter? Because responders lose time when they cannot get to you fast. No, there is not a study that tested your doorknob. But we do know this: systems work best when nothing slows the chain. A 2024 study from UT Southwestern found that EMS agencies using 4 or more key best practices had double the rate of favorable brain recovery after cardiac arrest. The top group had a 12% favorable neurological survival rate, compared with 6% in the lowest group. In other words, when the emergency chain works smoothly, people do better. Your part of that chain is the doorway. Here's the 30-second version. Call, sit, unlock, light on, path clear, pet secured, phone on speaker. That's it. And please, do not start searching for shoes, dentures, your insurance card, or a sweater. Those things feel important because they feel normal. But normal is not the goal right now. Safe is the goal. Before we go further, if this is making sense so far, hit that like button. It tells me you want more videos like this. Number 2, put the right information where help can see it. Most people think paramedics need to figure it out when they arrive. But actually, the faster you give clear facts, the safer your care can be. When responders walk in, they want answers to a few simple questions. What happened? When did it start? What medicines do you take? Are you allergic to anything? Have you had this before? Do you take blood thinners? Blood thinners are medicines that make bleeding easier, like warfarin or apixaban. Now imagine trying to answer those questions while shaking, sweating, or struggling to speak. Hard, right? That is why this step matters so much. A 2024 Yale study found that 6.5% of older adult emergency department encounters resulted in potentially inappropriate medicines after discharge. Why does that matter here? Because medicine safety is a real issue in older adults. Small medication details can change big decisions. So while you wait, if you can do it safely, place a short list where it can be seen fast. Not a giant folder, not your whole filing cabinet, just the basics. Write your full name, birth date, main symptom, start time, allergies, top medical problems, list of medicines, include blood thinners, insulin, heart medicine, and anything for pain or anxiety. If you use oxygen, write that too. Keep it large and simple. One page is enough. If you already have your medicines in a pill organizer, place that near you. If you have bottles in one basket, bring the basket. If you use a phone, keep a note called Emergency Med List. Update it once a month. What if you cannot write? Then put the medicine bottles on the table near the door. What if you live alone? Tape a card inside a kitchen cabinet or on the fridge. Paramedics often look there. And here's something people forget. If you wear a medical bracelet, point to it. If you have diabetes, say it. If you take an anticoagulant, that means a blood thinner, say it. If you have fallen and hit your head, say it. Those details change what the team worries about most. I'd love to hear your story. What made you click on this video today? Share in the comments, but wait until you see number 1. Because this is the step people either skip when they need it or use when they absolutely should not. Number 1, use aspirin only if it fits the emergency. Most people think aspirin is always smart in an emergency, but actually aspirin is helpful in some cases and dangerous in others. Let me be very clear. Aspirin is not for every emergency. It is not for stroke symptoms unless a medical professional tells you to take it. Why? Because some strokes are caused by bleeding, not a clot. And aspirin can make bleeding worse. But for a suspected heart attack, aspirin can help by making blood less sticky. That means it is less likely to keep building a clot. A 2024 study from Harvard T.H. Chan School of Public Health found that if adults took aspirin within 4 hours of severe chest pain, 13,016 deaths could be prevented each year in the United States, even after accounting for bleeding risks. That is a huge number. Another review published in 2022 by researchers working through Japan's Acute Coronary Syndrome Guideline Group found lower death rates when aspirin was given before hospital arrival. 30-day deaths were 4.2% with early aspirin, compared with 7.4% without it. 1-year deaths were 10.3% versus 19.6%. Those are not small differences. So what should you do if you have crushing chest pressure, chest pain spreading to the arm, jaw, or back, heavy sweating, nausea, and shortness of breath, and you are told by emergency dispatch or a clinician to take aspirin, or you already know this is part of your personal heart emergency plan? The usual emergency amount is 1 regular 325 milligram aspirin, or 4 baby aspirins of 81 milligrams each. Chew it if instructed. Chewing works faster than swallowing whole. But there are important exceptions. Do not take aspirin if you are allergic to it. Do not take it if you have active bleeding. Do not take it if you are vomiting blood or passing black stools. Do not take it if you may be having a stroke with face drooping, arm weakness, speech trouble, or sudden severe headache unless a professional specifically tells you to. And do not take it if your doctor has told you never to use it. This is why I call this the smartest step, not the fastest step. It must fit the emergency. So the full 3-minute technique is simple. Call first. Say the time. Sit and set the scene. Put your medical facts where help can see them, and use aspirin only when it is clearly the right emergency and it is safe for you. Let's pump the brakes for a second. I'm not saying this to scare you, but not every serious symptom should be handled the same way. Sudden face drooping, arm weakness, or speech trouble can be stroke. Aspirin may be the wrong move. Sudden heavy bleeding is different. Choking is different. Severe allergic reaction is different. Low blood sugar is different. That is why the first rule is still to call emergency services and follow the dispatcher's instructions. If you have stroke symptoms, do not eat or drink while you wait. Trouble swallowing is common and choking is a real risk. If you have chest pain and you are alone, do not drive yourself unless there is absolutely no other option. A much older but still important University of Utah study found that people who used private transportation sometimes reached the hospital slightly faster, but treatment actually started faster when EMS was used. In other words, getting there is not the same as getting treated. See a doctor right away or call emergency services immediately if you have new chest pain, sudden trouble breathing, fainting, one-sided weakness, slurred speech, a severe sudden headache, confusion, blue lips, heavy bleeding, or a fall with head injury. And if symptoms fade, that does not mean you are safe. Sometimes the body gives a warning shot before the bigger event. So you're convinced, but thinking, how do I actually do this? Start simple. Make one emergency card today. Put your name, birth date, medicines, allergies, emergency contact, and front door code if you use one. Put one copy on the fridge, put one in your wallet, put one by your bed. Next, make a phone note called emergency start time. That way, in a crisis, you can type one time and show it fast. Then choose your waiting spot. Pick the safest chair near the front door. Make sure that area stays clear. No loose rugs, no stacked boxes, no shoes in the path. If your doctor says aspirin is part of your heart emergency plan, keep the right dose where you can reach it. One regular 325 milligram tablet or 4 81 milligram baby aspirins in a clearly marked place. But only if your doctor says that plan fits you. If you live on a budget, do not worry. This is not about fancy devices. A pen, an index card, a flashlight, and an updated medicine list can do a lot. Even a piece of tape on the fridge can help. And if you have diabetes and your doctor has warned you about low blood sugar, keep a separate plan nearby too. That may include 4 ounces of juice or 3 to 4 glucose tablets for low sugar if you are awake and able to swallow safely. That is a different emergency plan, but it matters just as much. Look, there's a lot of noise out there. Too many people think surviving an emergency is about luck. Often it is about preparation and those first few calm decisions. You don't need to overthink this. Start with just one step today. Make the emergency card. That alone can make the next step easier. Your body will tell you if something is wrong. Your job is not to be brave and wait. Your job is to respond early and clearly. If this helped you, hit that like button. And if you want more videos like this, make sure you're subscribed because we post new health tips every single day. Stay healthy, stay strong.